So since 2003, we know that WHIM syndrome is caused by mutations in a gene called CXCR4. And these are autosomal dominant mutations that cause a gain of function in the protein. So this is quite unusual because most of the time we imagine that mutations cause a loss of function. But here, on the contrary, when the patients have a mutation in CXCR4, they actually get an increased signal due to the CXCR4 mutation. So globally, there are two ways of looking for genetic mutations. One of them is to sequence one specific gene. This is a very effective approach if you know what disease you're looking for. But most of the time, you have a constellation of symptoms that indicate more or less what disease it is, but maybe not so specifically that you know which gene to target. I think there has been tremendous progress made in the past decade in genetic diagnosis with the advent of what's called next generation sequencing. So next generation sequencing covers multiple different techniques, but in particular, it has enabled the creation of gene panels, which instead of testing only one gene at a time, can test up to 300 or more genes from a single DNA sample. This has been incredibly efficient in increasing the diagnostic yield. Today, when clinicians prescribe a genetic analysis, they're able to use these next generation sequencing techniques to screen a number of genetic diseases and get to the right answer in a much faster process than if they were screening individual genes. X4 Pharmaceuticals as a company is really trying to raise awareness around WHIM syndrome, and to facilitate diagnosis of these patients, we've partnered with a genetics company called Invitae, which has enabled us to offer patients and physicians the ability to get next generation sequencing free of cost for patients who appear to present symptoms or manifestations of congenital neutropenia.